Day, everybody, and happy New Year once again. I'm joined by two gentlemen working really, really hard to keep our island healthy and safe. Of course, my buddy Pat Luces, the incident commander at the Department of Public Health and Social Services. Good morning, Pat.
Good morning, Jace.
Yeah, and I can tell Pat just got in the office because his badge there over his right shoulder is still swinging. So like public health is,
Yeah,
is kind of real early.
we're bright and early.
There you go. And of course, that signature laugh and I guess the signature Disneyland virtual background in the back, of course, none other than Dr. Bob Leon Guerrero, the interim medical director over at Public Health. Thanks, Doc.
Well, you're welcome. Half a day. And I'm
All right.
actually now no longer acting. They took away my acting license, so now I'm the actual medical
That's
director.
right. Congratulations. Well, very very well deserved after a quite a long time. But you know, the mission obviously does not change. And
No.
I would even say, guys, the last time we actually convened here on Zoom, we were talking about the possibility that it was expected that the numbers would go up a little bit just because of the holiday season. Pat, are the numbers kind of like on par with what you were projecting? Because I know this week or this past weekend we got like, what was it, 224 positive cases?
Yep. Yeah, we had about 224, and so we did expect, because of the holidays, a little bit of congregation. So we did expect some of our numbers to go up, but not too bad.
Okay. And to all obviously curtail the fact that, you know, the virus continues to move through our community, but hopefully at a manageable level. Doc, there is a debut tonight of a vaccination clinic at a very familiar place.
Chamorro Village. When we had the vaccinations, specifically only at the plaza and at the public health, the usage went down. And then the incident commander and a bunch of other smart people, not like me, came up with an idea of going to the people. It's not, it wasn't a new idea, but it was a resurfacing of ideas of going to the people. So we actually went to Skinner Plaza during the time that they had the lighting, and we only did it two days a week. And then the first week it was like for a 2-hour period, we had like 30 and 35. And the next week we went up to 56 and 57. And so when I asked the people there, why did they come here as opposed to going to the plaza or going to Guerrero or in around public health? They said it's more convenient. So yeah, it's near where I work. And so that's why people are trying to go to places where people are at. Not only are we going to be doing the Chamorro Village, but Pat can talk about it more. But we're looking at going to the Micronesia Mall, either Micronesia Mall, GPO, Ganya Shopping Center, one of those places.
And of course, you were at the Plaza previously, yeah. Another very highly trafficked place, which I know from personal experience when I had to go there and get my confirmatory test, Pat. You know, like I had a good amount of foot traffic for vaccinations.
Right. So we'll actually be at the plaza until the end of January. So our last day there will be on January 31st. And then our new location will actually be at the Ganya Shopping Center on February 1st. And we'll put more announcements out on that one.
So, and of course, because you're doing this, the premiere, I'm sorry, I'm in show business, so I say like premiere, debut, whatever, of the vaccination clinic tonight, it's going to coincide with something that typically gets a lot of foot traffic, of course, the Chamorro Night Market downtown. So where exactly, Pat, is the vaccination clinic going to be in relation to, you know, all the hustle and bustle and the hubbub of, you know, spicy pork and wonderful like trinkets that people can buy?
Yes, there is a lot of foot traffic for food and cultural items. So we want to take advantage of the opportunity. We are going to be over at the Chamorro Village Hut number 4. These are the new Chamorro huts that are down there. So on hut number 4, a little bit away from the crowd, but giving opportunity for us to hopefully have a line and get people vaccinated. So,
okay.
Come on there. We'll be there starting tonight and every Wednesday for the rest of January. So we're looking at January 18 and January 25. We'll be there from the hours of 4 to 6 p.m.
Okay, now for people that have gotten the vaccination before, is there any difference as far as, you know, like the protocol for what they need to bring, or, you know, how long they can expect to be there, or, you know, I mean, just the fact that it's open air. I mean, is it still like, you get your shot, you wait for like 10, 15 minutes. They just want to make sure you're okay. And, you're on your way.
Yes,
everything's
correct.
the same.
Yeah.
Go ahead.
Sorry, Pat,
everything's the same. No.
Public health just so polite. Okay, go ahead, Pat, and then Doc can speak on that.
Yeah. So just bring your vaccine shot records if you have it. That way we can put the updates on there. And just bring your ID if you are and you can always bring your whole family over. So yes, the usual.
Okay, and then Doc, if for people that say, am I able to mix and match, vaccines that I've had before? I've always been, either because I prefer one particular brand over the other one, or it's just worked out that way. Are they able to actually say, can I get a different one than the one I got previously?
So the recommendation's always been to stick with the same vaccine that you started with. But due to shortages, sometimes people do mix and match, as you say. And in different countries, that they actually do that as a routine. So it's they say it's a little bit higher response if you mix them, but the overall results that you see is about the same.
Okay, and then Pat, you were saying like it's a very family-friendly event, and you're actually encouraging, based on what you saw previously with the vaccination effort down at Skinner Plaza. People are coming. Parents are coming with their children or their kids. Siblings are coming with the younger ones. You're even saying like grandparents and Ninas and Ninos are bringing the younger ones, right?
Yeah, that's what we saw at Skinner Plaza. People were coming to come and have a dinner with the food trucks, and they're there to enjoy the lights. And so this is going to be an attractive area on Wednesday nights. Heavy foot traffic, and so people coming in there with their families and their friends, and so we encourage them to come over to our vaccine site.
Okay, Doc, I just had a hypothetical just popped into my mind. Of course, because the night market is known for, like we're saying, so much wonderful food, and the barbecue is you smell it all the way at Paseo Stadium. Are you able to get the vaccine on a full stomach? Apologies if that's like a fairly obvious question already, but if you're planning on getting the vaccine, can you eat first?
You can do whatever you want. Vaccines, you don't swallow it, so it's an injection, so it does not have anything to do with the stomach. So
okay, and then conversely, it also doesn't. You also don't recommend or it's not recommended that you have to have a full stomach or not, right? So you're good either way.
No, right.
Okay, and then Pat, I know it's first come first serve, obviously, and your staff is so well trained. I mean, they've got this down to a science, which Dr. Bob's obviously very, very good at the science thing. Are people able to make appointments as well as just line up?
Yeah, this will be all walk-ins, first come, first serve. We'll be giving all the COVID-19 vaccines and then the bivalent booster, and we cover 6 months and older. So, yeah, we'll cover just about almost everyone.
Okay, so any final words, Doc, about how important it is that our people and our community make sure that they come out and get the vaccine, even if they have gotten the second booster round previously?
Yes, most people that have good immune system probably for now only need the 2 vaccines. But as you can see from the people that have passed away, the older you get, the more health problems you are. Your immune system does not work as well. So that's why we have the booster, to help boost your immune system. The new vaccines are what they call bivalent because it has the original COVID vaccine, plus it also has the Omicron subvariant, so that it tries to cover as much as possible. We don't know who responds for the 2 doses, and that's what the booster's for, to help your immune system respond. And we may not be seeing as a high amount of as the states mainland has been seeing, and that's because maybe because we're highly more vaccinated than the states are. And the better coverage you have, the least likely you're going to catch it. And if you do catch it, the least likely you're going to be serious enough to be admitted. And then, of course, the least likely you're going to die from it. So, yeah, the vaccines help. And it tries to make us go back to where life was. And I think this is going to be our new normal. Just like the flu shot we get every year, and every year we have outbreaks. This is what's going to happen. We're going to have the flu and also COVID once a year.
Mhm.
Hopefully, just once a year.
Well, certainly the one thing that hasn't changed at all about our island community is the fact that we practice in famliies, and our highest virtue is the fact that we have respect for one another, and that hasn't changed. So it's really, really wonderful. And to you two gentlemen and the agency you represent, it's a credit to all of you to actually get people out there and get the message out that we need to do what's right to take care of each other.
Well, it's also thanks to people like you spreading out the news. Obviously, we're good at public health, but we're not good at news. So it's a symbiotic relationship. We need you guys, people like you, to spread out the word, and hopefully people will listen.
Well, I got the easy part, man. So thank you, Doc. Can do, will do, and Pat will give you the final word. Lifelong Packers fan and everything. So what do you think about? Sorry, I was going to go there at some point, but like what do people have to do so that we can continue living, as Doc said, like our island way of life, even though we've got to adjust to like this inconvenience.
All right. Although the Packers are not in anymore, but we always look at the light at the end of the tunnel. And so we're going to be out there at Chamorro Village tonight. But I did want to mention also that next week, if you're not able to, if it's down at your area, we have the Inarahan vaccine that will be there also next week, Thursday, at the it will be at the senior. It'll be at the mayor's office in Inarahan. Again, that will be from 10 a.m. to 2 p.m. I just wanted to put a plug out for that one. And then also, if you wanna, if it's more convenient for you, you can actually make an appointment at our Northern Community Health Clinic, and the number for that one is 635-7400. Or you can always make an appointment down at our Southern Community Health Clinic, and the number for that one is 671-828-7604. And like Dr. Bob says, Jace, we want to thank you and KUM for always being a partner in getting the message out to our community.
All right, and shout out for Mayor TC down in Lahan for hosting that very worthwhile event and making sure that the people of the South are adequately covered. So, gentlemen, we really, really appreciate it, and thank you, Insidus Masi, once again for what you're doing to keep our community safe.
Thank you, Insidus Masi.